Governor Mohammed Abdullahi Abubakar, who was represented by the Chief of Staff, Government House, Abdul Sule Katagun, said the Bauchi Opportunities for Responsive Neonatal and Maternal Health Project of the Canadian government is well fitted into government's programs geared towards reducing maternal and infant mortality and morbidity. Government, he said, is worried about the death of women during childbirth, which is why it allocated 16% of the 2016 budget to the health sector to strengthen primary health care, create demand, and provide life-saving drugs. Governor Mohammed Abubakar said government will work together with Plan International Nigeria, implementers of BON, to implement the project. He promised to sustain the project.
Bauchi State happens to be one of the poorest areas in the country, and because Bauchi State needs this kind of intervention from our development partners. And of course, we should not forget that the governor went out of his way to invite and to seek for their intervention into this project. So this is the reason why they are here in Bauchi. We have encouraged them to come to us. They came here because they realized Bauchi is a place where they can work, where they can assist. And it will help us develop our poverty levels, our neonatal and maternal death levels, and all the necessary things that need to develop the populace of the state.
In a message to the launch Canadian High Commission in Nigeria, through the heads of corporations, Linda Henrich expressed delight that the project is aligned with programs in the state and commended government for showing a strong political will. Country Director, Plan International Nigeria, Hussaini Abdul, said the maternal mortality rate in Nigeria is unacceptable, as no woman should die bringing life to this world. He said BON is coming to the state with a zeal to improve the indices. 2 million women and adolescent girls are to be reached with services in 10 local government areas of Bauchi, that's Toro, Kirfi, Darozo, Katagun, Jama'ari, Gamawa, Misau, and Ningi. To achieve the project's objectives, the quality, availability, utilization of essential maternal, neonatal, and family planning services would be improved in remote and hard-to-reach areas. The project, he said, is aligned with the UN's Every Woman, Every Child global strategy and will help drive process towards reaching targets within Sustainable Development Goals 3 and 5. Hussaini Abdul said BON will be implemented in household, community, and facility levels. Giving an overview of Global Affairs Canada's priorities in Nigeria, Linda Henry said the Canadian government has been working in Bauchi since 2002 to reduce the burden of diseases like malaria, polio, diarrhea, and also strengthen health system. The Canadian government has provided $13.7 million Canadian dollars for the project. In their goodwill messages, representatives of the traditional institution, Ministry of Health, Women Affairs and Development partners welcomed the project. Elizabeth Carr reporting. The state governor, Mohammed Abdullahi Abubakar, who spoke through the Chief of Staff, Government House, Abdul Sule Katagun, said government has strategized to diversify its source of revenue and thus has decided to pay attention to agriculture. The present administration has refurbished the fertilizer blending plant and is supporting farmers to engage in dry season farming. The crop seeds and other farm inputs given to 2,000 IDPs was carried out with support from the Food and Agricultural Organization. Governor Mohammed Abubakar pledged to provide an enabling environment for the project to succeed. Executive Director, Oxfam Quebec, represented by Evelyn Mary, said Line Project plans to improve the livelihoods of 10,000 farming households through a combination of crop, livestock, and nutrition interventions, reaching 80,000 people in the process. This makes the Line Project a holistic approach to tackling poverty and malnutrition, creating wealth and employment opportunities, and thus contributing to efforts made towards ensuring sustainable economic growth in Bauchi. The partnership will contribute to advancing the 4-point agenda of government in agriculture, education, tourism, and health. The Line Project will also work to define and ensure adherence by farmers and pastoralists to market specification to ensure effective market access that truly results in increased incomes and profits. The executive director said the launch is a journey that will enable the partnership that will deliver benefits to Bauchi people. As a market-based agricultural initiative, the project is expected to result in increased yields in maize, sorghum, sesame, dairy and meat value chains for men and women farmers and improve nutrition for vulnerable farmer households. Other speakers said the project will be implemented in 6 local government areas. Elizabeth Carr reporting.